North Carolina public health agencies, and that includes North Carolina Public Health Association. And we are so excited to have you here with us today for this lunch and learn about firearm injuries and prevention opportunities, and to have this expert panel assembled today. We are just so excited. We had over 100 people register for this lunch and learn, and I know folks will continue to join as we move through our meeting, but I wanted to kick us off because we've got a full agenda and lots of great information to get. So wanted to get us started. I want to thank Kim Dittman, Operations Officer of NCPHA, for her hard work putting this panel together. We've got folks registered from across the state of North Carolina and also out of state. So thank you for being here. To our members, welcome. It's great to see you. For those of you who are not members of NCPHA, we would love to have you join. I think Kim's going to include the information in the chat so you can learn more about our organization. We've got over 1,000 members, and we meet regularly throughout the year to support local public health throughout North Carolina. Thank you, presenters, for sharing your expertise. We're really looking forward to hearing from you. And last but not least, we want to thank our sponsor, Civic Federal Credit Union. And I think Kim's going to share her screen now for a brief message from them before we get started. Kim?
We are Civic. When we all come together, we can do great things. Our mission is to improve lives and to invest in communities. Civic believes banking should be simple and affordable. As a credit union, we understand there's so much more to life than money, but so much depends on what you do with it. We're using finance as a way to help the citizens of North Carolina do good and do well. We are Civic Federal Credit Union, and we're excited to meet you. Visit meetcivic.org today.
Thanks, Kim. I'm going to turn it over to Rod Jenkins at this time for our welcome and introductions. Rod?
Thank you so much, Katie. And good afternoon, everyone. I'm Rod Jenkins, Public Health Director for Durham County. And it is a very great pleasure for me as Vice President of NCPHA and also the Chair of the Public Awareness Committee to welcome you to this very special Lunch and Learn webinar. Gun violence and gun safety are issues that are simply public health issues. The solutions are available, and the will to provide those solutions are available. We want to inform you all about what's available too. Our agenda contains the brightest minds in epidemiology and those who actively participate in preventing violent acts. Many eyes are upon us. As Katie mentioned, we have individuals who are joining us from out of state and throughout the state of North Carolina. So at this noon hour, I thank you for taking time out of your busy schedules to learn more about these issues affecting the communities that we dedicatedly serve. I hope you will find in here the satisfaction and guidance to either make decisions or inform decision makers about the gun violence, gun safety, and ways to curb these threats that are simply threats to the public's health. We extend grace and gratitude to our friends at the Injury and Violence Prevention Branch of the North Carolina Department of Health and Human Services. Their dedication to the work that they do and the deliverables that they produce are simply amazing. And now to a man that needs no introduction, we will now hear from Scott Preshabell for additional introductions. Scott?
Hey, thank you so much, Rod. I appreciate
See, Scott, I can't hear you.
Just a data trends overview. Shanna, you good to go?
Oh, sorry, Scott, I couldn't hear you. I didn't realize you finished with the introductions. Yeah, let me go ahead and share my screen. All right, so hello everybody. I am an epidemiologist in Scott's shop at the Injury and Violence Prevention Branch. And today I'm going to be sharing some data with you all from the North Carolina Violent Death Reporting System. For those of you that aren't familiar, the NCVDRS data triangulate data on violent deaths from death certificates, law enforcement reports, and from the Office of the Chief Medical Examiner to build out robust systems for us to monitor violent deaths, including intentional and unintentional firearm injuries. So looking first at the trends for the most recent 10 years from NCVDRS, we've seen there's been a 26% increase in firearm deaths in the state over the last 10 years, with 1,379 deaths that were firearm related in 2019. Firearms are the most common weapon used in all violent deaths, representing 63% of violent deaths in 2019. Among our firearm deaths, most of these are suicides. As you can see, there were 778 suicides involving firearms in 2019, followed by homicides. This other category includes legal intervention deaths where there may have been a law enforcement officer involved. Unintentional firearm deaths, there were 15 of those in 2019, and deaths of undetermined intent. Looking at rates by demographic group, you can see these rates for sex and age group here. We've aggregated data across 3 years from 2017 to 2019 to be able to show you as many categories as possible. But you can see males shown in the blue bars. Males represent the vast majority of firearm deaths, 85% of those deaths over this 3-year time frame. And for males, rates are higher across the board, but particularly in the 85 and older age group, as well as the 20 to 24-year-old age group. The younger ages are more commonly homicides, and the older population are more commonly suicides. Looking at rates by race and ethnicity, again, you can see males have a disproportionate burden across all racial and ethnic groups. However, rates are highest among non-Hispanic Black residents in the state with a rate of 36.5 per 100,000, followed by American Indians. And for females, rates are also higher among American Indian females, followed by non-Hispanic whites. If we look at the breakout by race and ethnicity among these firearm deaths by manner, you can also see that there's differences in the manner of violent death among these firearm deaths by racial and ethnic group. For example, for non-Hispanic whites, 86% of violent deaths involving a firearm were suicides, whereas with non-Hispanic Black, American Indian, and Hispanic populations, deaths were more commonly homicides. One of the benefits of the North Carolina Violent Death Reporting System is that we're able to capture data on circumstances surrounding our violent deaths to understand a little bit more about the why rather than just counting the number of deaths. On the left, you can see circumstances for our firearm suicides by sex, shown in purple, and then on the right are some common circumstances for firearm homicides by sex. For female suicides, on the left, you can see that almost 60%, were experiencing a current mental health problem at the time of suicide, which was higher for females than males. Females were also more likely to be currently receiving mental health treatment. Intimate partner problems were common in 20 to 24% of suicide deaths, and suicide intent was disclosed in around 20% of suicides. For previous suicide attempts, that was more common for females, and that can speak to the variation in method or means where males are more likely to use a firearm in a suicide death than females, where females, it's sort of split between firearms and poisoning as a means. For our homicides, argument and conflict was common in about a third of those homicide deaths. 25% of male homicides were precipitated by another crime, and that was more common for males than females. Similarly, drug involvement was more common in male homicides than female homicides. And that last one, intimate partner problem, or intimate partner violence, was present in 45% of female homicide deaths over the 2017 to 2019 time period. And before I hand it off, I did want to share some additional data resources. We have a new North Carolina Violent Death Reporting System data dashboard that is up on the website and includes additional data on firearm-related deaths. And that is also includes data by county, so you can get a little lower than the state level there. We also have our annual reports and fact sheets with additional data on firearm deaths. And I also wanted to touch on NC Faster, which is a new enhanced surveillance activity that we received funding from CDC to monitor non-fatal firearm injuries in the emergency department setting to understand sort of that broader impact of firearm injury in the state. And also wanted to highlight the comprehensive suicide prevention funding we recently received from CDC, which is using evidence-based strategies to prevent suicide, many of which involve reducing access to lethal means and incorporate activities that you'll hear more about from other presenters today. So with that, here's my contact information as well as Scott's, and happy to take questions now or at the end, and I can pass it on over to Kurt as well. Thank you.
Okay, let me jump in. My name is Philip Cook, and Scott asked me to moderate the presentations and the discussion. I'm happy to do it. I've been working in the general area of gun violence prevention off and on since almost the beginning of time. And it's a pleasure to be have this connection with public health people, and I'm glad to do that. One of my roles has been as an advisor to Scott on the North Carolina violent death reporting system, and I can vouch for the fact that it's an extraordinary resource and one of the early ones. And it has really furthered our understanding of violent crime in North Carolina by providing such a rich source of data and infrastructure. So the way I'd like to manage these 4 presentations is to invite quick questions following each presentation if there's matters of clarification or a question that's very specific. Then it would be fine to raise that now, and otherwise, after we have all 4 presentations, then we'll have a general discussion, a cross-cutting discussion. And so let me just one quick question for Shanna, which I prepared her for. I'm sure many of you want to know what happened in 2020 as well as 2019. If you read the New York Times article yesterday, you know that nationwide there was a near 30% increase in homicides. Most of it was with gun, a record-breaking departure from the previous year. So Shanna, what is the North Carolina experience in 2020?
Sure, and I'll preface with the fact that we did use the violent death reporting system data for the presentation today, and there is a lag time with those data because of the abstraction process to aggregate data across those 3 systems, really to get at that circumstance element as well as waiting for those law enforcement reports. So that's partly why the data I shared were only up to 2019. We can look at our death certificate data alone, which we have provisional data for 2020. Again, still not final. We are going through the process of transitioning from a paper-based to electronic reporting system within our death certificate data. So that transition kind of adds to that lag in that previous paper-based system. But looking at our provisional data for 2020, we have seen an increase in firearm deaths of about 15% from 2019 to 2020. I will say the 2019 number of firearm deaths from the death certificate data was a little bit lower than previous years. There were 1,396 deaths in 2019 from the death certificate data and 1,610 provisionally in our 2020 data. So we have seen an increase there. And I think, Phil, you had also asked about assault specifically, given that statistic you had found. And we have also seen about a 16 to 17% increase in assaults over from 2019 to 2020, looking at provisional data.
Great. So terrible news, but better than what the rest of the nation has experienced by a wide margin. So that's intriguing. Let's go on then with the second presentation by Kurt Michael, who is a clinical psychologist at Appalachian State University. And let's see, if you want to just share slides and we'll go ahead with it.
All right, hopefully you can all see my slides and hear me. Okay, great. Hi, I'm Kurt Michael. I'm professor at App State in the mountains of North Carolina. And also for context, I think it's important for you all to know that along with my colleague, JP Jamieson up here in the mountains, we run a series of mental health clinics in the K-12 schools in the area. And you also might not be surprised to know, as I share my next slide, that we have one of the higher suicide rates in the state. So if you look at this red line, that would be North Carolina, which kind of models the US rates pretty consistently. Obviously, the rates have gradually increased, at least in this time frame, which is about 18 years. But all that time that the rates have remained relatively consistent, both state and national. The rates that we have in Western North Carolina continue to be above that. And there was a little bit of a downward trend in 2019 that doesn't appear here, but we're not sure at this point because there's an embargo on the data for 2020 at this point. We'll soon find out, but at least there was a little bit of a downward trend, but we're expecting, or at least predicting, some of that will continue to be higher than we want it to be. So this is just a general picture of where we live and also what the state and national rates look like overall. And these were all accessed through a free data tool called CDC Wonder. More particularly in Western North Carolina, you'll notice here on the red line indicates firearm suicides, whereas the blue line is firearm homicides in Western North Carolina specifically. And what we've seen over the last several years is a pretty consistent trend that between 3/4 and 80% of firearm deaths in Western North Carolina are determined to be suicides. So in other words, we have a particular problem with firearm suicides in the western part of the state, which may not come as a surprise for folks, but it's important to mention. Now, this slide is really meant to illustrate maybe 50 to 60 years of research in suicide prevention. We regularly ask the question why people opt to kill themselves. And though those questions are important, I think the less asked question is how they die by suicide. And so this is a slide that we took from the Means Matter website to really emphasize the pivot that we've made in Western North Carolina to focus more specifically on reducing access to lethal means, in this case, particularly firearms. And so again, I think when I showed my opening slide, I mentioned counseling on access to lethal means. So the focus that we've had over the last several years is to try to create better ways to communicate with patients and families around reducing access to firearms, even temporarily. And so this next slide, I'll just give you a warning. There's going to be the sound of gunshots, but this is a public service announcement for the state of Utah. Just want to go ahead and show that and then maybe talk about it on the other side.
Last year I was at my lowest, going through some pretty serious depression. A couple of friends of mine stopped by the house and said they were worried about me. Said they'd feel a lot better if they could hold on to my firearms until things turned around. I think they saved my life.
If your loved ones are struggling, talk to them about temporarily storing their guns away from their home, because things do get better.
So it might be something to discuss during our discussion time, but just a couple of things to point out that occurred to me, even when I watched this, maybe for like the 100th time. I always get new information each time I watch it, but obviously one of the main messages is that people go through acute crises. And so I think for this particular gentleman who was a firearms owner, the emphasis is on temporary storage. That way that when the suicidal crisis has subsided, that you can return to your beloved use of firearms without necessarily sending the message that we're there to confiscate your guns. And so I think a lot of folks in Western North Carolina would not be super receptive if you're trying to reduce the chances of suicide death, that you're somehow going to suggest that they get rid of their guns. And I think that's kind of the message that we want to communicate is really promoting safety as a priority, and really not discussing or getting into the weeds around what it means to own firearms at all. It's really designed to be an apolitical conversation. So really, the thing that I want to maybe use as discussion points is to highlight a few of the things that we know in the literature. Number one, that oftentimes suicidal crises are brief. We want to make sure that people get through that crisis safely and without causing serious injury or death as a result of the method that they might have access to. And it's true that some methods, especially in Western North Carolina, being guns, are far more lethal than other methods. I think the one really good piece of news that oftentimes surprises people is that far greater than 90% of people who have made a pretty serious attempt actually do not go on to die by suicide. A lot of times people assume that suicide, if you've made an attempt, is inevitable. I think the literature would basically have a different answer to that. And then the last point here is that a lot of folks, even though it may seem obvious that they're 100% intentional about taking their own lives, that's almost never the case. If you talk to people who have survived serious attempts, they often talk about a great deal of regret, even at the very moment, let's say they jump off from a high place. The minute they have their hands leave the rail, they then regret it. Now, sometimes we don't get to know about what they're feeling in that moment because they don't survive. But for people who, for example, have survived jumps from the Golden Gate Bridge, have all pretty consistently said that they were very ambivalent and were trying to figure out a way to come to some decision that would give them relief. And oftentimes that particular event of jumping is not the thing that they were expecting it to be. That really the goal is to try to create some time and distance between that suicidal person, maybe banking on the fact that it's likely to subside at some point. They're not permanent crises, and that putting distance between that person and a highly lethal means can be the very opportunity to not only save a life, but to then provide that opportunity for treatment. So I'm happy to talk to you about some of these main talking points, but I think that pretty much concludes my presentation. So I'm going to kick it over to Sue, I guess, after we hear from Phil for a minute.
Yeah, thanks, Kurt. I appreciate it. And anybody who has a question can put it on chat or use the raise hand. I encourage you to do that. And for now, just in the spirit of a clarifying question, is your primary audience, Kurt, counselors and psychologists? Is that who you're reaching?
So basically, yeah, we train social workers, counselors, psychologists. We have a doc program at App State. And again, we're trying to train a whole nother generation of clinicians across those disciplines to implement lethal means reduction counseling as a regular feature. One of the things that we've noticed is that generally speaking, folks that are trained in suicide prevention are trained in a linear fashion. And obviously, when we're talking about the prevention of suicide death, that how of suicide is almost never discussed consistently. So we want to change the equation in both training and practice, that we include these kinds of discussions as a regular part of that intervention strategy.
There's a lot more to be said about that, but congratulations on your program there, which I think is vitally important. Let's turn to Sue Ann Pilgreen, who is with the gun safety team in Pitt County, and I think this is actually a natural progression to talk to her. So Sue Ann, if you want to share your slides, we'll go.
Absolutely, thank you. Oop. Working a little backwards. Okay, everybody can see my slides? Perfect. Thank you so much for the introduction. So in an effort to really combat the firearm injuries and death that we were seeing here in Pitt County, one of the things that we have done is to start a firearm safety coalition. After we saw a really significant spike in the number of firearm injuries we were seeing, we knew that we had to take a more proactive approach. So back in March, we actually launched our coalition. We had our first meeting. I will have to say we modeled our coalition after the Durham County Gun Safety Team, which was started in 1999, and really used their work, experience, and expertise as a springboard in getting us started. They had some amazing materials for us to use. I had several phone calls, so I have to kind of take my hat off to them. I co-chair our coalition with the suicide prevention coordinator from the VA. And this partnership has worked beautifully for us. The bulk of my background is children specific. And so she actually brings in that veteran and adult expertise. So we've worked well together. She's also able to provide direct connection for free gun locks and suicide prevention education that specifically targets the adult population and veterans. Our team is nonpartisan, apolitical, multi-sector. We're just really aimed at the reduction of injury and death from firearm violence, 100% about safety and prevention. Key components, and there's really 3 key components that we see. Education is first and foremost. In addition to really looking at the obvious sharing of safe storage education, we really had to do a genuine assessment of our community. Knowing the data and the makeup of those that live in your service area is going to play a key role. So for us, Pitt County is a farming community, and we knew that hunting was a really big part of the lives and the family traditions of many who live here. In my family, for example, NC State home football games and the opening day of deer season takes precedent over most anything else. I know that my family is not unique. And if we had chose to dismiss the demographics of Pitt County and our people here, we knew that we were going to miss a large part of our vulnerable population. Dissemination is that second big piece, and it's crucial that you really bring the right stakeholders to the table. It's the coalition members that have served as our liaison between their networks and our coalition, and it's really allowed us to reach a much broader population than we would have been able to reach otherwise. And then that third component is the interventions. And this piece really encompasses the boots on the ground work. And it may be setting up booths at a community event, partnering with our local health department to distribute gun locks and education. It may be some other event that they're sponsoring, speaking to schools or civic groups, just talking to individuals. It looks very different on a daily basis, and it looks very different for each of our coalition members. This piece is also about making connections and really making resources easily accessible. When we first started, we realized that some of our law enforcement agencies were not connected to Project Child Safe. So just simply getting them connected and being able to get those free locks has been huge. Just a couple of our coalition successes. We did a press release back in June that really helped to get the word out. We've done a huge firearm safety campaign. And one of the big things that we did is the development of an actual logo, and that has been a huge conversation piece. People are talking, and so that is one of the biggest factors here, is really talking about a subject that historically hasn't been talked about. So getting started for you, just a few key pieces, really knowing your community, getting to know them, knowing that partnerships are key, knowing what your resources are, and asking for help. The development of this for both Durham County and for Pitt County, it's not unique just for our counties. It's definitely something that can be duplicated and done in your counties and areas as well. That's it.
Okay, thanks very much, Suzanne. And the chat messages are enthusiastic about your logo. So you may get some imitators out there. I don't know, but it is very appealing. And there don't appear to be any specific questions. Let me once again jump in and just ask, have you made any kind of outreach to gun dealers in Pitt County and talked to them?
So that is one of the things we are in the midst of doing now. Is really doing some of that outreach. We've made a really strong connection with somebody in Martin County, which is a county right next door to us. And we're really utilizing her to help us to build those partnerships here in Pitt County.
Interesting. Okay. More power to you. The final speaker is David Johnson with Bull City United in Durham, where he's a supervisor, and look forward to hearing from him.
Thank you. Good morning, everybody, and I'm sharing my screen. Once again, thank y'all. My name is David Johnson, the supervisor for Bull City United. Bull City United is Durham County's anti-gun and anti-violence program, intervention and prevention program that's focusing on doing violence intervention through a public health lens that's treat violence as a treatable disease using the care violence model. So with that, when we say community-based, we mean people that's directly from the community that's have lived life experiences with violence, with gangs, and being members of the community that's experienced the most violence in the city. The care violence model is basically it's a 3-point model, and we use this just like you try to treat any contagious disease like we treat violence as, where you detect the interrupt, identify and treat the highest risk individuals, and you mobilize the community. We detect the interrupt potential deadly conflicts through preventing retaliations, mediating conflicts before they even turn to violence, and trying to keep historic conflicts cool. We work with the highest risk individuals in those neighborhoods. We try to work with the highest risk that's most to be exposed to violence, in the mix of violence, or have a direct hand in the violence that's transpiring in the city. And we try to change those behaviors. We try to change those behaviors through, first and foremost, us just with lived life experiences, just showing them and telling them what our experiences was, showing them it's a better way, providing them with resources so they can change their behaviors. Not so more as doing the talking, just more as providing resources, giving them different opportunities to take change those negative behaviors into positive behaviors. And thirdly, we mobilize the community. We respond to every shooting in our focus and target area. We bring positive messages, we bring positive resources to those communities. We partner with all type of different organizations. Our fire safety team to pass out gun locks in the community. We partner with just different organizations to provide resources, mental health organizations. So we do a lot to try to bring resources where the community's at instead of trying to take the client to the resource. As far as targeting our focus, we are a data oriented, database, data proven program. Everything we do is based off of data, and our data comes from Durham Police Department. When we first started Bull City United, we was given the 2 highest gun rate census tracts in the city. And we have tremendously lowered those numbers in those 2 census tracts. I wish I could show y'all the slide, but some kind of way it did not make it on this presentation. I'm so sorry. But we have a great impact and effect on reducing violence in our target area. And we do that through mediations and just being good, great messages of peace, being credible messages that done live this life and letting these young people know that it's a better way of how they can live life and make it through some of these situations. Community engagement and events. Like I said, we do a lot within the community. We have a week of peace that we hold every year to dedicate to the lives that we lost throughout the whole city. We have great turnout. We have a Say Summer event where we go through the hardest hit neighborhoods in the city of Durham of violence and just provide a safe atmosphere for people to come outside and feel safe. We have a celebration of peace event that we do every year just to show what peace looks like in the community. We do a lot in the community, just engage in the community, seeing what resources are needed in the community. We have brought out the expungement program to this community. We have brought out the Stop the Bleed program that just give the community ways that you can do gunshot wounds. You can put pressure on gunshot wounds and things of that nature. So it's just different avenues that we use just to engage the community and bring resources to the community. And lastly, I want to say about our community partners. We have and it's not even all of them, we have a list of community partners that we partner with. Our biggest ones is the city of Durham, just recognizing the work that we was doing in those first 2 census tracts and investing $935,000 to expand to 4 additional census tracts within the city. We have a great understanding with Durham Community College where we're creating a pipeline from the community straight to the classroom with trade skills, GED programs, or anything else that they offer that we can provide those communities in need. And lastly, one of our biggest recent partners is Duke University Hospital, where they're actually partnered with us to launch their violence recovery program. And that's basically getting violence interrupters and mediators right to the hospital bed while the victim is there shot, seeing if it's a conflict, we can mediate, seeing if anything we can do that can provide that victim with any kind of hospital resources they might need in their road to recovery, or any kind of other resource they might need of getting out of a conflict, or anything else they might need when they get out the hospital. So BCU, Bull City United, we does a lot. We have a lot of things going on. And thank y'all for letting me present.
All right, thanks very much, David. It's a really challenging time for you, I'm sure, as it is for everybody connected to Durham. And I really appreciate your effort along the way. Again, I want to go ahead and open this up that people, I think it'll work to have people simply unmute themselves and jump in, but if you're shy about that, you can also put something on chat or use a raise hand. So we're eclectic about it. And just to get things rolling while you're thinking what you'd like to say, I want to ask David whether he would talk a little about the relationship with the Durham Police Department, and if that's not a problem, I'd be very curious, since there's obviously a lot of overlap. So
No, sir, I have no problem with it. Technically, we have no technical relationship with Durham Police Department. We receive shooting data, shooting data and things, and shooting data and just basic reports of violence in the census tract that we're covering. But outside of that, we have no interactions with law enforcement. What we feel like what we do and what the police department do are two different things, but at the same time trying to meet the same goal. We just on two different roads trying to do it. It is imperative to keep the credibility of the people working in the community. I cannot say that enough. Just for safety reasons for the individuals that's working in the community, them not looking at being labeled as a snitch or something like that. It's imperative for one, getting the information to stop some of these conflicts, and for two, our safety. Phil, so no, sir, we have no. That's the far as we go with the police department is the data portion, and I think they understand that.
Got it. That makes a lot of sense. All right. So anybody would like to come in? And we've had 4 very stimulating discussions about gun violence, about crime, and about suicide, and about the trends thereof. So what would you like to learn in addition on this?
I have a question for Sue-Ann and also Durham. Is who convened the Peake County Firearm Safety Coalition? Was it the trauma centers, the health department? Who brought the group together?
We actually did it here out of the hospital.
Okay.
I had connected with Trisha
Okay.
From Durham County, and she connected me with the VA, with the suicide prevention coordinator there. And then it kind of was birthed from there.
Okay.
And in total transparency, I came into this role, Lily, as you know, about 4 years ago. And since coming, I have known we needed to do something. But somebody in the chat had, made a comment about, just all the political piece. And I think, that puts a fear factor. But we've got to get past that. I mean, this is totally about prevention, totally about safety. So yeah.
I mean, in Forsyth County, I'm with the Level 1 Pediatric Trauma Center. So we were at instead of the state fair, our local Dixie Classic Fair or Carolina Classic Fair now. And what we did, we survey the participants. Most of them are gun owners. And what we wanted to find out was what kind of locking device they use. And if they didn't have one, we offer free trigger locks. And we were next to the health department, the kids area, and then they offer cable locks. So we were still, the pediatric surgeons are going to publish, the findings, but most of individuals, 635 people completed the survey, and most of them prefer trigger locks. But it wasn't, again, it's not a political conversation. To those parents that were not gun owners, we just opened the conversation about, hey, if your child's gonna go and spend the night at somebody's house, a friend's house, go ahead and ask the question, can you make sure your guns are secure? And then the other empowering conversations, parents realizing, hey, can I get a trigger lock? I just got my wife a gun and we don't have a locking mechanism. So that's what we did here. But I'll be reaching out to you, Sue-Ann and Trisha.
Absolutely.
Thank you.
Well, I thought it would be a good thing to add something. So oftentimes when you're talking about a family that it's not just one firearm, it could be multiple long guns, multiple handguns. And by the way, we are not super big fans of trigger locks because they're easy to manipulate and tamper with. So we would prefer a cable lock over a trigger lock, just to give you a little bit of sort of on the ground advice if you decide to implement these things. These are just some limitations. We also have things that we work with multiple families that say share custody, and we have to talk about mean safety for multiple homes. So it's a fairly complex process. And there was one more point I wanted to make. I think there was somebody that asked the question in the chat about follow-up. A lot of times when you do main safety work, it takes multiple conversations to get them to even consider alternative storage strategies. So there was a question about follow-up, and that's a key part of this lethal means reduction work is follow-up. So just thought I would add that in.
Kurt, can I ask about the status of any sort of red flag law initiative in North Carolina?
Yeah, we try to stay away from anything that would be red flag. I mean, there's certainly things that are being proposed, and in certain states they have bona fide red flag laws. What we're really trying to do is have a conversation that wouldn't necessarily be prohibitive in that sense. We're trying to create an opportunity for this to be a negotiation to promote safety. And so we try to steer clear of some of that conversation, because I think when folks get the sense that you're going for some type of confiscation, even if legally indicated, clinically, we try to not be the ones that participate in those discussions. If there's a legal requirement for someone to not possess a firearm, let's say it's a domestic violence situation, then that would be something that we would probably involve law enforcement. But from a clinical standpoint, we're trying to make this happen voluntarily in the service of promoting safety.
Yeah, thanks. That makes all kinds of sense to keep yourself distinct from that.
I have a question for David. He mentioned that you provide resources to the gun violence victims to encourage them to, or discourage them from further violence. What sort of resources do you provide? I know you mentioned like a gun lock, but I didn't know what else you provided them.
Education opportunities, job opportunities, anything they might feel like they need to succeed without picking up a gun. We carry a caseload. I'm sorry if I didn't mention this. Bull City United consists of two different components. We have violence interrupters that's directly involved with stopping conflicts, and then we also have outreach workers, and their job is to work with those high-risk individuals and provide and assist them with any resource they might need to overcome whatever struggle they're going through in life, not only being a gunshot victim, but say if they want to get back in school, or say they need food just for the day, just to stop them from going out there and committing a robbery or something like that, or going out there doing something that can lead them into getting into a conflict. We provide everyday resources to our high-risk individuals that's on our caseload. So it just depends on the need of the individual what we have to go out and find, to be totally honest.
Dave, can I follow up on that and just ask about helping victims get access to the victim compensation money from the state?
And that's something I feel like our partnership with Duke will highlight. Some victims don't even have the knowledge of that program, and just having the basic knowledge of the help and the resources that's out there after you're a victim of gun violence. I feel like Duke is going to play a major role in helping us in that regard.
Philip, I was also going to add that Bull City United has been instrumental in our COVID pandemic relief efforts. They've been very instrumental as far as, making sure that, the folks that they serve in the census tracts are aware of the vaccine, serving as vaccine ambassadors. And also during election times, they have voter drives to ensure that they are able to get to the polls and actually vote. So by extension of the work that they do and being affiliated with local government, they do a lot of great things.
Shannon, could I ask about the National Syndromic data system that you said that you're part of the FASTER program, and this is kind of this remarkable new CDC initiative to try to get overnight indicators of big changes in infection rates or in shooting rates, presumably. How does that look? Are you going to be able to figure out what's a shooting and what isn't, and be able to use that?
Yeah, we think we will be able to. We're starting to do that now. So in North Carolina, we have a homegrown system called NC Detect. NSSP that you mentioned is the national system. The Bioessence platform and many other states use that system. But in North Carolina, we do have NC Detect. NC Detect are our most timely data for syndromic surveillance. And we get a data feed about 3 times a day of updated data. So it's certainly a great way for us to identify those types of injuries. The other big difference between the syndromic data and some of the other data that we use is we're using traditionally our code-based system, the administrative codes that are assigned to the health record for billing purposes, where the syndromic data look for key phrases and key words to say this is a shooting but not a flu shot, for example, to rule in and rule out those ED visits that are related to an injury. So we've certainly been testing out our definition in the FASTER program. And where we're running into some things are around classifying intent, where someone may have a code for a shooting, but the intent information isn't clear. So we're certainly identifying those firearm injuries, but we're diving in a little bit deeper to parse out intent. And we're working on finalizing our first quarterly report. So we'll be putting out data on a regular basis to allow folks that are working to intervene in firearm injuries and to prevent those injuries to ensure they have the information they need.
Always impressed at how North Carolina ends up on the cutting edge of these public health initiatives, and this is another example of that. So it makes me proud. So let me push my luck with Dave. I think this Bull City United, it is of course a model that has been adopted in other large cities. I wonder about other cities in North Carolina and what the prospects are for getting it adopted more widely, and what you would advise for somebody who wanted to do that.
Yes, currently Gifford County, Greensboro has a cure violence site, and also Charlotte has duplicated the cure violence model based off of Bull City United's efforts. And also just thinking, I think Greenville has reached out, and Wilmington has reached out. New Hanover has reached out to come up here just to do some research about the model. But worldwide, it's a global model. The cure violence model is a global model, and it's effective everywhere it has been. So I recommend it not only for what it can do for the community, but also it changes the lives of the people that works for it too. I can't stress this enough. With Bull City United, and just the cure violence changed my life in the direction of my life personally. So I will always speak highly of this program and of this model, because I'm a person that I know this model works for. I was a former gang member, not only in Durham, but in North Carolina. I was one of the highest gang members in North Carolina at one point in time. And this program helped me change my life around, but not only me, helped me go back in the community and help my community. So I will always sing the praises of this model and of this program because I haven't seen nothing like it.
Let me ask a very practical question. How many of the people you work with are being on salary and how many are volunteer? So what is the mix of volunteer and salary?
Right now, we have a number of volunteers, but everybody on staff is paid staff through permanent, being a permanent Durham County worker or being a contractor, starting off as a contractor until they become a permanent county worker. But if we're asking you to put your life on the line, we're definitely trying to put you on a salary to compensate that. But yeah, we have many volunteers. We have volunteers that just come, they try to participate in the things that we do on the events that we throw. But everybody that works in VCU, we try to pay them.
Excellent. Yeah, good. All right. Any last comments or questions for the good of the order here? Scott, do you want to jump in or?
Sure, Phil.
Katie?
I'm happy to jump in just real quick. Again, I just want to thank you all so much. The presentations were great. We tried to give a range of kind of prevention activities. So things that we're talking about suicide prevention, things that we're talking about community violence. And again, the idea is hopefully to get some ideas out there and to generate additional work and prevention activities. So please feel free to also follow up with folks and maybe recommend watching this webinar for those who weren't able to attend today live. I think it'll be posted sometime next week. And it's really, I think we have a lot of places doing a lot of interesting things. If we can kind of make sure that those are effective, really test them, and then really share them widely, hopefully we can actually have an impact on some of the violence that we're seeing. So Philip, thank you for moderating the panel. Thank you all so much for coming out today. It was great to hear about the work that you're doing, and we certainly want to share that as widely as possible. So thanks again. And I think unless Kim or other people want to say any final words, that's probably the end of the session.
No, thank you, Scott, and thanks everybody for attending. We're so glad to have you and hope you have a great weekend.
Yeah, thank you everyone for all your presentations. It was excellent. Thank you.
Take care, everyone. Thanks again.
Have a good weekend.